I'm going to perform my health assessment today. So before I go into the patient's room, I'm going to gather all my equipment, perform my overriders, wash my hands, perform patient hygiene, and then before I even touch the patient, I'm going to identify the patient with 2 identifiers. Can I have your name and date of birth?
Kylie Mazielko, 3/19/1996.
Okay, and then what brings you in?
I had surgery a couple of months ago on my ankle, but today the pain is pretty severe.
Okay, how would you rate your pain on a scale of 0 to 10, 10 being the worst?
I would say today it's probably an 8 or a 9.
Did you take anything for your pain today?
I did. I took Tylenol and ibuprofen.
How much Tylenol and how much ibuprofen?
I took 1,000 Tylenol and then 400 milligrams of ibuprofen.
Okay, do you have any allergies?
I'm allergic to cats, and then environmental, ceftonir drugs, doxycycline, and then gluten.
Okay. Is your chart updated with those allergies?
Yeah, it should be.
Okay, what is your past medical history?
I have asthma, allergies, celiac, and then Ehlers-Danlos.
Okay, have you had any previous surgeries?
I had 2 shoulder surgeries and then an ankle surgery.
Okay, any family history?
My mom has a history of cancer, and my dad has a history of high blood pressure, and my sister experiences migraines.
Okay, do you get your do you smoke?
I do not.
Do you do any drugs?
No.
And then what about alcohol?
Occasionally, but not often.
Okay, and then do you get your yearly checkups?
I do.
And do you get vaccinations, like your flu shot?
I get my flu vaccination every year.
Okay, perfect. All right, now I'm going to perform the patient's vital signs, which include the heart rate, the pulse ox for her oxygen, her temperature, her blood pressure, and then reassess her pain. And now I'm going to go into the general assessment. So the patient looks well appearing. Her skin is warm and dry. Doesn't look like she has any lesions or bruises. She looks overall healthy. Her level of consciousness, can you tell me your name and date of birth?
Yep, it's Kylie Mazielko, 3/1996.
And then do you know where you're at?
Yeah, the doctor's office.
Okay, and then who is the president?
Joe Biden.
Okay, so she's alert and orientated ×4 to person, place, time, and situation. And her speech is clear, fluent, she's understanding what I'm saying, and she's expressing using her facial expressions. And now I'm going to go into the OPQRST. So what was the onset of your ankle pain? You said it was the surgery, after the surgery?
After the surgery, there was pain, but I would say today it got significantly worse around 10 a.m.
Okay, and then how would you rate the quality of your pain?
I think it's a sharp pain.
Okay, does your pain radiate?
Sometimes it goes up my leg a little bit, but it really stays pretty much in my ankle.
Okay, and then the severity, how bad?
I would say it's probably an 8 or a 9.
After the
out of
Tylenol
10.
or before the Tylenol?
Before the Tylenol, and now it's down to maybe a 7.
Okay, now I'm going to go into I'm going to go into your mobility and your gait. Can you walk for me?
Sure.
Okay. Okay. So she has a little bit of a limp because of her ankle pain. I'm going to now do her neuro assessment. So I'm going to shine this light in your eye, okay? Can you remove your glasses?
Sure.
Okay. Can you follow my hand? Okay, perfect. So her pupils are equal, reactive, round, accommodated. Her extraocular motion is in full range. And then can you grab my fingers and squeeze as hard as you can? Perfect. And then can you flex up and then flex down? Perfect. And then the other thing. Okay, so the one side's a little bit weaker. Now we're going to inspect your respiratory system. So I'm just going to watch your breathing. So her chest wall is equal bilaterally to respiratory efforts. She's not really using much effort to breathe. Now we're going to perform lung sounds, so I'm going to pull your shirt up if that's okay.
Yep.
Take a deep breath. Again. Again. Alright, now I'm going to do your back.
Sure.
Take a deep breath. Again. Okay, perfect. So her lung sounds were clear. I didn't hear any adventitious sounds. And now I'm gonna ask questions regarding her respiratory system. Do you have any shortness of breath or any cough?
No.
Okay, perfect. Now we're gonna move into your cardiovascular system. So I'm gonna check your apical pulse and your radial pulse at the same time.
Okay.
Okay, her apical pulse and her radial pulse were equal. And now I'm gonna go and look at the auscultate the rest of her heart sounds here. I'm gonna pull your shirt up again.
Yep.
And then I'm gonna check your carotid artery.
Okay.
Okay, heart tones were normal. Alright, are you having any chest pain or swelling that you've noticed recently?
Nope.
No? Okay, perfect. Now I'm gonna go into her skin assessment. Her skin is smooth, there's no bruises, it's normal to touch, it's pink dry. I'm gonna check your hydration status, okay? I'm just gonna
Okay.
pinch
Sure.
you here. Alright, so she's clear for dehydration. I'm gonna check your capillary refill. Alright, that's good. And then have you had any bruises or lesions that you've noticed?
No.
Okay. Now I'm gonna move on to her GI system, so I'm gonna have you lie down. You might wanna fix that.
Like make it so you can see.
Alright, so if when I'm looking at the patient, she doesn't have any distension, I don't see any masses, anything bulging out from her. Do you have any pain in your
Nope.
stomach? Okay, now I'm gonna auscultate. Okay, so she has normal She has normal bowel sounds. Now I'm gonna palpate you, okay?
Mm-hmm.
Does anything hurt?
Nope. Nope.
Okay, you can sit up.
Okay.
And then when was your last bowel movement?
Yesterday.
Okay. Do you have any pain in your flank area?
No.
All right, and then what is your voiding pattern, like when you urinate? Is it pretty frequent?
I go every couple of hours depending on how much water I drink.
Any color or odor you've noticed?
No, it's usually yellow.
Okay. And then any concerns with your ankle? What are your
I'm
questions?
just worried that it maybe is not getting better.
Okay. All right. Well, that ends my assessment. I will let the doctor know how the assessment went, and then he'll come in and examine you further. Okay?
Thank you.
You're welcome.